Welcome to Simply Pain, an educational DVD based on a lecture by Jane Green, a clinical psychologist specialising in pain management. This DVD is designed to provide a clear understanding of pain for people who suffer from or work with sufferers of long-term pain and their friends and families. Although this DVD touches on strategies for managing pain, it is not intended as a replacement for attending a pain clinic or pain management programme. What is pain? If you imagine the little green men came down from Mars. In Mars, they do not experience pain at all. They have no concept of what pain is. They see a human saying, "Ouch, I'm in pain." And they ask, "What is pain?"
So how are you going to answer that question about what pain is?
Let's start by saying that there are two kinds of pain, and there's the physical, as well as we just have to describe them as emotional. They're not one or the other, but they do affect each other and exist simultaneously.
Great, okay, thank you.
The body's way of telling us that something's wrong.
Brilliant.
A discomfort within yourself?
It's kind of a warning sign as well, isn't it?
Uncontrollable.
It can be debilitating.
Yeah.
A sensation that you want to stop as soon as possible.
Something that prevents you from doing other things.
Yeah, I was going to say a handicap that doesn't allow you to perform to your full potential.
And you said handicap?
A handicap.
Handicap.
Also, there's no way that anyone else can appreciate exactly the kind of pain you're in, so it can be frustrating.
So you said it's frustrating.
Pain as a sensation is very difficult to describe. We've just heard our audience's attempts to describe pain. Here are some descriptions given by an audience of long-term pain sufferers. An uncomfortable sensation. You can't understand it if you haven't experienced it. A warning about potential injury. It stops you doing things. It takes over your mind. It's very tiring. It makes you cry. It makes you feel down. It makes you feel angry. It makes you feel frustrated. What we say about pain is that there are three aspects to it. There's the somatic bodily sensation without which pain wouldn't exist. There's the cognitive thinking aspect of pain. It affects how you think. It takes over your mind. And there's the affective element to pain. Pain affects the way we feel emotionally. Now, if we look at the statements we have here, we can decide as a group where they fit in to our three aspects of pain. Are they mainly to do with the somatic aspect of pain, the bodily sensation? The cognitive aspect of pain, the way pain makes us think? Or the affective aspect of pain, the way pain makes us feel?
For example, physical would be somatic, a bodily sensation, and emotional would be affective, the way pain makes us feel emotionally.
Body's way of telling us something's wrong.
Somatic.
But leading into cognitive.
Yeah. I mean, given that they're all somatic because they are it is a bodily sensation. So we'll give it a little S because it is somatic, but it's taking over your mind. It's making you think something's wrong. Let's do something about this. Okay, discomfort. What are we going to call that?
Emotion.
All right. What about this? It's a warning sign.
Cognitive.
Right. Yes. It's going to take over your mind, make you think, I must do something about this. Uncontrollable.
Cognitive and affective.
Debilitating.
Affective.
Sensation you want to stop.
Affective.
I wouldn't say no to cognitive for that. Actually, aren't huge right and wrong answers to this. Prevents you from doing other things.
Cognitive and maybe all three.
It has an effect on your emotions.
Yeah.
And also what you can do in terms of physically.
Yeah. It's a handicap.
A somatic experience, but it has a consequence on your emotions.
Yeah.
Causing some of the things that we said, like frustration.
Yeah. No way anyone else can appreciate it, which led on to it being frustrating.
Yeah, really long things.
So another affective bit, and I might give that a little cognitive bit, because you might be thinking there's no way other people can appreciate it. Now, if we look at this, accepting that, of course, there's a somatic element in all of it, because you wouldn't have the pain if there wasn't something going on in your body. But the interesting thing here, and that's what this exercise is all about, is to demonstrate that although the pain is a somatic experience, where it actually has the most effect is on your thoughts and feelings, which is really bad news for people who've got long-term pain, but quite good news if you're a psychologist, because it gives you a job.
The 2 points of this exercise are firstly to show that while pain is felt somatically, as a bodily sensation, where it has the most effect is on the sufferer's thoughts and feelings. Secondly, to demonstrate just how difficult it is to describe pain. The International Association for the Study of Pain defines pain as an unpleasant sensory and emotional experience associated with actual or potential tissue damage, or described in terms of such damage. The association worked long and hard, and this was the best description they could come up with. So even experts in the field recognise that pain is a difficult concept to define.
In pain clinics, we categorise pain into 2 types. Can anyone tell me what they are?
So like short, sharp pain and dull, aching pain.
Acute, and do you know what the other kind is?
Chronic.
Yeah, absolutely, yes. Chronic just means long-term. It comes from the Greek word chronos for time, and that's all it means. And I think in everyday language people tend to use the term chronic to mean something that's really bad, but it doesn't mean that. So people can have chronic pain without it meaning it's very bad pain, it's just gone on for a long time. And we say pain that continues longer than 3 months or beyond the normal healing time. So acute, which actually comes from a Latin word which means a needle. But in fact, we're not using it in pain clinics to talk about that sharp pain that you were describing. In pain clinics, we just mean short-term pain. And again, most of us recognise, I mean, if we said something was hurting us acutely, we'd probably be describing something sharp and stabbing, but in the pain clinic, it just means short-term pain. So, it's pain that goes away with healing.
Of course, if there's no healing, or if there's an ongoing painful condition, then the pain will persist.
Now, there are things that we say in pain clinics that I'm going to qualify a bit. Can anyone else think of differences then between acute and chronic pain? What might distinguish them?
Could get used to chronic pain.
Can get used to it?
Yeah, and sort of come in and out in terms of the effect on the mind.
Right.
Acute is a lot harder to ignore.
Perhaps that chronic pain is more connected to emotional pain. It could be more linked to depression since it lasts and has a lasting effect on the mind.
So it leads to secondary problems.
Yeah.
E.g. emotional distress. And if you've got short-term pain, it may be hard to ignore at the time, but when it's gone, so you don't get that secondary problem. Anything else anyone can think of?
If chronic pain doesn't have a clear cause, it might be frightening because it's mysterious.
Yeah. So often in chronic pain, the cause is unknown. And that, as you say, that leads to all sorts of problems. It's frightening, and it's upsetting because you're worried, you don't know what it is, you can't tell other people what's causing it, so that leads to other secondary problems. We say about acute pain, cause is usually known. And that's probably true to an extent. Something happens, you break your leg, you know that that's what's caused your pain, and there you are. But we've all experienced pains, I'm sure, where you might have had a pain for a day or two and you thought, this isn't very nice, if this goes on, I better go and see my doctor. And then after 2 or 3 days further, it's gone away and you forget about it. So you never did know what the cause was. And you've probably had experiences where maybe you have gone to see a doctor and he's kind of looked and said, well, I'm not quite sure what this is, but try that. And then the pain goes away, and so it's not a problem. So although we tend to think that an acute pain cause is usually known, it isn't always known, but it's more of a problem when it goes on and on and on, that nobody can find a cause for it. We also say about acute pain is that treatment is usually helpful. And in chronic pain, we say treatment is of limited benefit. I didn't know this until I started working in pain, that there are an awful lot of people around who are suffering long-term pain for whom treatment isn't effective. And it comes as quite a surprise and a shock if you're one of the people who's suffering from it, because most of us are used to taking an aspirin or paracetamol or whatever when we've got a pain, and the pain goes away and there's an end to it. So it's surprising then to discover that it can be a case that the pain doesn't go away. But having said that the treatment's usually helpful, if you've got a toothache or you've broken your leg or you've got a headache or whatever, those things, the acute pain is going to go away. So what you need then is something that's going to take the edge off it and allow you to get on with some kind of quality of life. It doesn't matter that it doesn't get rid of the pain entirely. And I think, again, if you think back, probably when you've taken painkillers for short-term pain, it's been enough to keep you going, to keep you ticking over, but it hasn't got rid of the pain entirely. But that same degree of pain relief, if you've got long-term pain, isn't enough. Whereas when you've got short-term pain, you know it's going to get better, you can soldier on if the edge is taken off it. If you've got long-term pain that isn't going to get better, it is debilitating, as we said earlier, and it becomes a big problem. Now, the definition of pain is that it is an experience associated with actual or potential tissue damage, or described in terms of such damage. And what's the function of pain then, normally?
To prevent further damage.
Yeah, it's to prevent damage, and it's a useful warning. And if you don't have pain, if you don't experience pain, then your body suffers for it. There's a little girl who I don't even know if she's still alive, who was born near where we live, and she was born without any pain sensation. And her parents realised something was wrong when she started chewing off the end of her tongue and biting her fingers, and they had to remove her teeth to prevent her from doing that, and her fingernails likewise, because she was scratching herself. So it's a real problem. It's bad when you have long-term pain, but it's actually a bigger problem when you don't have pain. It's a bigger threat to you physically. And I don't know if she's still alive, because if she had appendicitis or something, she wouldn't know. If she is still alive, undoubtedly by now, all her joints will be affected. If I lean on something and I overextend the joint, it hurts, so I stop doing it. And it's not a big issue. But if you've got no feedback, no feedback of what you're doing in terms of pain, you're missing that useful warning, so you go on extending your joints and you end up with damaged joints. What about in chronic pain? We've said this is pain that's continued but beyond the normal healing time, so we assume that the healing has taken place, but you're still getting pain. Is that a useful warning now?
No.
No, it isn't. It's a useless message. So basically, the hurt that you feel in long-term pain doesn't equal harm.
We categorise pain into two types, acute and chronic. Acute pain is short-term pain. The cause of acute pain is usually known. It is usually related to injury. It goes away after healing. Treatment is usually helpful. It is a useful warning to, for example, take your hand out of the fire before it burns. Chronic pain is long-term pain lasting more than 3 months. The cause is often unknown. Although you get the sensation of pain, which is normally an indication of damage, there is no ongoing damage. The pain persists beyond the normal healing time. The treatment is often of little benefit. It is a useless message, as the pain does not equal harm.
Right, now let's look at this.
In understanding pain, it is important to understand where pain is felt. Our two five-a-side teams are playing each other for a local competition. During the match, one of our players breaks his toe. Where is the pain felt? The damage originates in the football player's broken toe. The message of pain travels up the nerves to the brain, where the brain translates the information provided to it by the broken toe into a message. The message is pain, which is shown in the expression of pain on the player's face. Of course, if the player was knocked unconscious, his brain would be unable to translate the message from his foot into a message of pain, and as a result, he would not experience the sensation of pain.
So, here we have our footballer, and he's damaged his toe really badly. The pain travels up the nerves, all right, into the spinal cord, up into the brain, and it's only when it gets up there that he'll say ouch. And if it doesn't get there, or if there's nothing awake there, then he's not going to experience the pain. So the damage is undoubtedly in the foot, the pain's experienced in the brain. On its journey up to the brain, the pain has to pass through various gates.
When our footballer first hurts his foot, the gates are open, allowing the message of pain to travel along his nerves, up the spinal cord and into his brain. But if our footballer broke his toe at the same time as he has the opportunity to score the winning goal, his thoughts would be concentrated on the match, which would have the effect of closing the pain gate. Despite his broken toe, he is able to block out the message of pain and score the goal that wins his team the competition. Now our footballer is euphoric that he has scored the winning goal. The euphoria has the effect of closing the pain gate and allowing only the feeling of euphoria to be experienced. It is only after the euphoria has worn off that our footballer is able to experience pain and realise for the first time that he has an injury. The gate is now open to the message of pain.
Goes off to hospital, and they cut off his boot, and his foot's a real mess. Bones, splinters of bone everywhere, blood, as bad as you can imagine. The hospital do their best, they send him home. He goes back repeatedly for the next 6 months, after which they say, look, we've got some really bad news. Gangrene has set in here. We're really sorry we weren't able to prevent that, and we're going to have to amputate, because if we don't amputate, you're going to die. So, they amputate. Is that the end of the pain?
Not necessarily.
Right.
People tend to feel it's like a whole phantom limb.
Absolutely. So, when people have an amputation for whatever reason, they come round and they often think they didn't do the operation, because they can still wiggle their toes or fingers or whatever, because the limb still seems to be there. If they haven't had a lot of pain prior to the amputation, that limb gets, the sensation of the limb gets closer and closer and closer to the amputation site, and then it sort of disappears, and that's the end of the phantom. For most people, some people have phantoms that go on for longer. If you've had long-term pain prior to the amputation, then the phantom's likely to stay, complete with the pain. So you've really got a double whammy there. You're without the leg, the foot, or whatever, but you've still got the pain. The reason it's important to know about that is that often when people have got long-term pain, they think, well, if only the doctors could find which nerves were affecting it, they could cut those nerves and that would be the end of it. Any ideas why you have a phantom, why you continue to get pain after an amputation?
Well, isn't it just completely there in your mind? You've been living with your leg your whole life and then it's gone. Sometimes I'm wearing glasses and then I take them off one day and I find that I'm pushing them up on my face. I'm like,
yeah,
I'm
absolutely,
not pushing up anything, but I think they're there.
And what seems to be the case is that you're forming memories in the spine, in the dorsal horn of the spinal cord. You form actual memories for pain and sensations like wearing glasses. And these memories, apparently, I don't know what they actually look like, but chemically they look like the memories that you form in your brain. It's not the same sort of memory in the sense that it's not something you can verbalise. It's not like saying how you got here this evening or what you had for lunch. But it's a memory nonetheless. And once it's there, it's pretty much stuck there, and it's really difficult to get rid of it. So that's certainly one reason why you continue to have the pain after an amputation or after the nerve is cut. And any other thoughts anyone else got?
Receptors in the brain looking for the actual limb?
Well, that's right, yes. The brain doesn't know that the limb isn't there, in a sense. And part of what may be going on is that the brain's now not getting any messages up from that bit of you. Normally the brain will be getting all sorts of messages that you're not sort of consciously aware of. They're the kind of I'm okay messages. And so if the brain doesn't get any messages coming up, then it assumes that I'm not okay, that there's some problem. So you've got things going on in the brain that make you feel that the limb is still there and still experiencing pain. The other thing that happens if you just cut a nerve, which they used to do, and they still do nerve blocks in pain clinics to deaden the nerve, but it's a bit like the difference between a fixed telephone system. If somebody cuts your telephone wire into your house, your telephone's gone, absolutely gone. But if you've got a mobile phone and one of the transmitters gets knocked out, your mobile phone will be looking around or sending out its message around, which may be picked up by a different transmitter, so the message will still get through. And the body is much more flexible than a fixed telephone line system, and it will find ways around damage. So if you have a nerve block or you have the nerves damaged, to stop the pain transmitting, after a period of time, your body will try and heal itself, and the nerves themselves may heal, or they may find that the body may find a different route to send that same message round. So cutting nerves is not the answer.
When the body is damaged, it tries to find ways around the damage and it tries to heal itself. So when a nerve is damaged, the effect is not the same as when a landline telephone wire is cut. When a telephone wire is cut, no signal can get through, and these two friends are unable to continue their conversation. However, after they resume the call on mobile cell phones, one of the transmitters is blown down by the wind. But when a mobile phone transmitter stops working, other transmitters may be able to pick up and send the mobile telephone signal. So when a nerve is damaged, the effect is more like what happens when a mobile phone transmitter is knocked out. Signals may still get through by using other routes.
Do any of you know about TENS machines? Right. TENS machines look like personal stereos or something, and they've got electrodes coming out. And what you do is you put the electrodes around the area, the painful area, and that stimulates other nerves. And then what happens is that